Hello, my name's Georgie Oldfield. I'm a physiotherapist and the founder of SIRPA Limited. And what I wanted to do in this video was explain to you a little bit about what the SIRPA practitioner training programme involves. Now, SIRPA Limited I initially set up in 2010 after working in the field of stress-induced pain for a few years and developing on the work that I learned initially from Dr. John Sarno when I visited him in 2007. And he pioneered this work for the previous 40 years or so. And over the last few years, I've been working with hundreds of patients. I've gained some great peer support from the American specialists as well, as I developed the SIRPA approach in order to be able to try and get the message out there in the UK that actually chronic pain does not usually have a physical cause. There's a lot of research to back this up these days, and yet still there is this belief that if you have chronic pain, there must be a physical cause, and therefore all we can do is manage it. But unfortunately, if the underlying emotional cause is missed, then the pain will continue to be managed rather than actually resolved. So the SIRPA approach is based on the concept that where any more serious condition is ruled out, tissue damaging conditions such as cancer, infection, fracture, or an autoimmune disorder, then you can almost guarantee that the actual pain, if it's a chronic pain, been going on more than about 6 weeks, will actually be triggered by the brain. So stress-induced, a psychophysiologic disorder. And then it becomes conditioned. The learned nerve pathways become conditioned, and then the pain just continues. Now, what we do within the SIRPA approach is actually look at the underlying cause. It's not a matter of digging into the past, it's a matter of identifying underlying issues. They may be past traumatic issues, they may be current stressful things, but it's identifying them and then actually carefully dealing with them, acknowledging them, getting to the point where patients are able to gain perspective, let go and move on with their life. But it's also about looking at how learned behaviours and personality traits they actually fuel the pain by the stimulation, the inner terminal that then triggers the emotional brain. So the practitioner training course is aimed at health professionals, whether that's physical therapists or whether that's mental health professionals, and helping them learn to integrate this approach within their own work with their clients. I'm not trying to teach them to do their job. For example, I'm a physiotherapist, so I cannot teach a psychotherapist how to actually do this, but what I'm doing is teaching the concept, teaching the neurophysiology behind it, looking at the various manifestations, and looking at various simple self-empowering treatment strategies that many patients can use with great success, and you have a very good success rate with this, especially when you consider it's actually conditions where many people have tried absolutely everything to recover, and they've just been helped to manage their pain. We're looking to change their lives, we're looking to actually resolve their pain, and it's happening over and over again. So if you're a health professional, maybe whether that's a mental health professional, whether you're a doctor, a physical therapist, or even a coach who wants to help your patients by understanding this technique, not the technique, but the actual concept and approach better, then please get in touch, because we have 4-day training courses so that you can then go off and incorporate this into your own work. And if you are a psychotherapist or a hypnotherapist, a counsellor, who maybe have some of your own tools that you've learned within your own profession, then these can actually come in very helpful for those people who may need some additional in-depth work.